Hello and welcome to Clean Slate, presented by Greenbriar Treatment Center, where we discuss the interesting world of drug and alcohol addiction. Tonight I'm joined by two experts from Greenbriar Treatment Center, Rachel and Kira, and we'll be talking about dual diagnosis treatments. Thanks for being on the show tonight, ladies.
Hi, Daryl. Thanks for having us.
First things first, tell us a little bit about Greenbriar Treatment Center.
Greenbriar is a drug and alcohol treatment center.
This is Kira.
Thanks, Daryl. We are headquartered in Washington, Pennsylvania. We have multiple outpatient locations throughout Western PA and two halfway houses that are also located in Washington.
Now, you are live and local, correct?
We are, yes.
Okay. And a 24/7 operation between
Yes.
the physical facilities, the helpline, and which we'll get into later on.
Mm-hmm.
Okay. Dual diagnosis. Very interesting topic. I don't think we've ever covered this one or discussed it that much on Clean Slate thus far. What is exactly dual diagnosis?
So a dual diagnosis facility, which is what Greenbriar is, means that we treat not only substance abuse issues, but also the mental health that also goes along with it.
Okay.
So if somebody has depression, anxiety, or any other mental health diagnoses, we're able to work with that and their substance abuse while they're with us, because we find very often that people are self-medicating to some extent to help them deal with their mood swings, to help them cope with really difficult times for them, which could be depression.
Sure.
And it spans. And we have a psychiatrist on staff. We have a whole mental health team, and that's what they're there for.
Now, Greenbriar does dual diagnosis as opposed to some facilities that just do straight the alcohol addiction or the addiction period?
Correct. Yeah, Greenbriar, we are a licensed dual diagnosis facility. So like Rachel says, that means that we treat co-occurring disorders.
Mm-hmm.
Okay.
Now, other facilities are able to prescribe medication for maybe previously diagnosed mental health conditions. But at Greenbriar, we have a psychiatric team that actually comes in and evaluates clients, is available to our patients to address any issues that maybe haven't been addressed before. And we are actually one of the only licensed facilities in Western PA.
Mm-hmm.
Really? Wow.
Yes.
So that's sort of an all-in-one treatment then, is what the patient receives at Greenbriar.
Correct,
Yes.
Wow.
because with co-occurring disorders, it's kind of like the argument which came first, the chicken or the egg.
Sure.
And you can't really treat one without treating the other. So, you know, for some people, their mental health issue might be situational. Say it is an issue of grief and loss from losing a loved one. That doesn't, that could have caused the stress that sort of instigated their use even further into an addictive pattern.
Okay.
But we still need to address that mental health issue.
Okay, so I was about to ask that. Actually, one feeds into the other, really? Is that how it works?
Absolutely.
Yes.
So that's the chicken and egg scenario you had laid out.
Absolutely,
Okay.
yeah.
Now, can any drug and rehab center provide this, or do you have to have specific professionals on staff on the mental side?
That's what Kira was talking about, us being one of the few licensed dual diagnosis facilities in this area. There are a million different things that you have to accomplish and achieve in order to receive that status.
Okay.
So, for example, like we were talking about the psychiatric team that we have, not every facility has that. We're able to diagnose people when they come in, really start to work with them, get their mental health medications figured out, and not a lot of facilities are able to do that just because they're not allowed. It's that simple.
Is it a matter of only a certain few get licenses, or you have to go through all these different steps you laid out?
I'm pretty sure there's a lot of red tape that you have to go through in order to achieve that, yes.
Okay, once again, this is Clean Slate, presented by Greenbriar Treatment Center. I'm here with Rachel and Kira from Greenbriar Treatment Center. And you can reach out to Greenbriar Treatment Center by calling them at 800-637-HOPE, 800-637-4673. You can also check them out online at greenbriar.net. This is Clean Slate, presented by Greenbriar. And overall, how is the actual treatment? How is the dual diagnosis treatment different than standard, air quotes, addiction treatment?
Sure. So there's a couple of things. Just from a practical standpoint, our staff is qualified to treat mental health. So our therapists are all master's level therapists that are licensed and certified appropriately to address both substance abuse and mental health issues. So just from a staff perspective, we have that. And of course, we have partnered with a medical team and a psychiatric team that come in and support us from the medication side. But also our actual treatment, we keep group sizes really small so that we can develop an environment where our clients feel safe to share what's going on. And also by keeping group sizes small, our therapists have adequate time to meet with our clients one-on-one, because some issues aren't always appropriate to discuss at the group level. So,
Right.
that one-on-one FaceTime with their counselor is so important. And if we were a treatment center that had 165 beds, our therapist wouldn't be
It's
able.
impossible.
Right.
It's impossible. The caseload just becomes too much. And I like to say that we're boutique and we're smaller for a reason. And that is the reason, because we give very individualized treatment. And our inpatient has a maximum of 62 patients. That's it. And like Kira said, there are a lot of places that have 150. There are some places that have 200 beds. And we don't agree with that approach, because we kind of feel we want everybody to truly get the most that they can while they're with us for that 28 days.
Now, treatment, is the dual diagnosis treatment, is it concurrent with the addiction and the mental side of it, or does it stagger at all? Is there a sort of similar beginning and end point, or am I in there for a few more weeks, months after for one or the other?
So it happens at the same time. So not all of our clients are dual diagnosed. So one of the things that we do is we have breakout sessions. So we will separate the dual diagnosed clients from the not dual diagnosed clients, and we will have groups that are specifically geared towards addressing their individual issues. One of the other things is we use some different therapy approaches, like cognitive behavioral therapy, dialectical behavioral therapy, and those are sort of treatment modalities that are used to address problems like depression and anxiety, but they're also really effective in treating basic substance abuse issues. So that way, all of our patients are getting what they need.
So you're finding that the treatment methodology for addiction is similar in
It
a
can
lot
be.
of cases?
Yes, it can be.
Okay. Now, how does a person get in touch with Greenbriar?
All anybody has to do is call our 1-800 number. That's 1-800-637-4673. We are available 24/7. I know people say that, and that's a joke. I sincerely mean that.
Sure,
You can call
absolutely.
us. That number is confidential. So if someone calls us, they have questions, they maybe don't feel comfortable doing that, talking to somebody, you can also get to us through our website, which is greenbriar.net, GREENBRIAR.net. And if you submit a question through there, we will get back to you very quickly.
Well, thank you very much, Rachel. That will do it for our show, Clean Slate, presented by Greenbriar Treatment Center. Now, be sure to catch us next time. And if you have any questions about getting addiction help for yourself or a loved one, please call Greenbriar's confidential phone line, 800-637-HOPE, 800-637-4673, or visit them online at greenbriar.net. That is, as Rachel just said, GREENBRIAR.net. Take care.